A woman in labor tens of thousands of years ago. No sterile room, no pain relief, just firelight, cold ground, and a handful of people who had seen this before. She survived. You exist because she did. But how exactly did they manage it? Walk on two legs and your pelvis changes shape. It has to. The same bones that cradle your organs and anchor your stride are the bones a baby must pass through to enter the world. Somewhere in the long arc of human evolution, those two demands, walking upright and delivering large-brained infants, stopped cooperating. The result is what anthropologists call the obstetric dilemma. A birth canal that is genuinely, measurably tight, and a baby whose skull is already pushing the limits of what that canal can accommodate. No other primate faces this engineering problem at the same scale. A chimpanzee gives birth with relatively little difficulty. A human birth, by comparison, is a feat of physical geometry that can go wrong in a dozen different ways. By the time Homo sapiens emerged around 300,000 years ago, this pressure had been building for roughly 2 million years of Homo evolution. The brain was getting bigger. The pelvis was not getting proportionally wider. The compromise was stark. Human babies are born earlier in their development than any of our primate relatives. Helpless, heads still partially soft, unable to walk or feed themselves for months. They arrive early because staying in the womb any longer would make delivery impossible. That is not a flaw in the system. That is the system. Now here is the part that reframes everything. Ancient people were not blind to this. The anthropological and archaeological record, including studies of present-day hunter-gatherer societies used as analogs for ancient behavior, suggests that communal birth attendance is nearly universal across human cultures. Solitary labor is the anomaly. It is a modern phenomenon, not an ancient one. What existed instead was accumulated expertise, experienced women, those who had witnessed many births, who carried the knowledge of what helped and what didn't, were present. Think about what that actually meant in practice. They would have guided the laboring woman upright or into a squat. That matters more than it sounds. Modern obstetrics has revalidated squatting and upright positioning as biomechanically superior to lying flat, because gravity assists the descent and the pelvis opens slightly wider. These women arrived at that same conclusion without a single clinical trial. They got there through observation, repetition, and the transmission of what worked across generations. They would have managed the cord, knowing to wait, knowing not to pull. They would have cleared the newborn's airway. They would have known which positions eased the worst of the pain and which made the passage faster. This was not guesswork. This was knowledge, hard-won and carefully kept, passed from one pair of hands to the next across thousands of years. 2 million years of evolutionary pressure. 300,000 years of Homo sapiens navigating it. Reduce it to its smallest frame. 2 hands in firelight, guiding a head through a passage that barely fits, while a woman uses every reserve she has. That is the scene. That is what the knowledge was for. It worked. Not always. Not without cost. The community and the positioning and the accumulated wisdom genuinely helped. But there were things no amount of human presence could fix. And that is where this story gets genuinely dark. That squat versus lying flat detail, ancient women landing on the biomechanically correct position through pure observation, does that change how you see their capabilities? Drop your answer in the comments below, because what they couldn't fix through knowledge alone is where this story takes a much darker turn. Complications were common, not occasionally, not in rare edge cases, common. Hemorrhage, obstructed labor, infection. 3 killers that no amount of communal knowledge or careful positioning could reliably stop. A birth that began with everything in the woman's favor could turn within minutes, and when it turned, there was no blood transfusion, no surgical option, no antibiotic on a shelf. The knowledge that had carried thousands of births through safely simply ran out of road. Demographic modeling of prehistoric populations suggests that across a full reproductive life, multiple pregnancies, not a single birth, as many as 1 in 4 women may have faced a childbirth-related death. Not per delivery, but cumulative. That figure is not a clean statistic. It is the weight behind every fire lit for a laboring woman in the dark. And yet, they did not face those complications passively. Archaeological evidence points to the deliberate preparation of medicinal plants going back tens of thousands of years. Residue analysis at prehistoric hearth sites has identified plant species with known uterotonic properties, compounds that cause the uterus to contract, which is exactly what you need to slow a hemorrhage. Other species identified at similar sites carry analgesic properties. The preparation was deliberate: grinding, heating, combining. Ancient people were running a pharmacological experiment long before anyone wrote a word about medicine, doing it by observation, by loss, by trying a different plant the next time. The knowledge that ergot-derived compounds could manage bleeding, that certain bark or root preparations dulled the worst of the pain, that knowledge existed in practice before it existed in text by an enormous margin of time. Then there is the second dark layer, the one that is harder to sit with. Infant death in the earliest days of life was so common that many ancient cultures appear to have delayed formal naming and burial rites for newborns. Anthropologists studying burial patterns across multiple prehistoric sites have noted that infants who died very young were often treated differently from older children, interred without the same ceremony, sometimes without grave goods or formal burial at all. The instinct is to read that as coldness. It was not. It was pragmatic grief management in a world where the first few days were the most dangerous passage a new life would face. Naming something meant opening yourself to a loss that arrived with terrible frequency. The delay was protection, not from the child, but from the unbearable repetition of formal mourning. A mother who had already buried children still came back to the birth fire the next time. She still knelt beside the next laboring woman. She still passed on what she knew, which position, which plant, which intervention had worked and which had not. That transmission is the real story underneath all of this. Every technique that worked got carried forward. Every plant preparation that reduced bleeding got remembered. Every positioning adjustment that eased a difficult delivery got taught to the next pair of hands. Across hundreds of thousands of years, that accumulated, embodied knowledge was refined and passed on. Refined and passed on again, until it reached the women who attended the birth that eventually, through an unbroken line of survivals, produced you. Modern obstetrics did not invent the instinct to surround a laboring woman with expertise and support. It inherited it. The sterile room, the monitors, the surgical suite, those are recent. The knowledge that birth requires community, attention, and accumulated human wisdom, that is ancient. That is the reason you are here. Subscribe for more on what ancient humans actually knew, and watch the next video right now.